योगी ठाकुर एक बार फिर से आपके सामने एक एक्सक्लूसिव एक टॉक लेके आ रहा हूँ, एक छोटा सा इंटरव्यू। प्रोफेसर डॉक्टर आर के गौरिया सर, जो इंडियन फोरेंसिक नर्सिंग के फाउंडर हैं, जिन्होंने बाद में इंडियन फोरेंसिक ओडोंटोलॉजी भी इस्टेब्लिश किया। उनका ये जर्नी कैसा रहा, उन्होंने जितना भी इसमें काम किया अभी तक, और कब से स्टार्ट किया काम, कितनी परेशानियाँ आई और कितना उनके पास उस समय मोटिवेशन था जिसकी वजह से वो ये सब कर पाए, और हमारी न्यू जनरेशन को उनसे क्या सीखना चाहिए। आज हमारे साथ हैं प्रोफेसर डॉक्टर आर के गौरिया सर, और मैं सर से पूछना चाहूँगा, सर आपका फोरेंसिक नर्सिंग का जो ये सफ़र रहा, कहाँ से स्टार्ट हुआ और इसका मोटिवेशन क्या था, और आपको क्या क्या परेशानी आई इसमें। थोड़ा सर हमारे व्यूअर्स को फोरेंसिक नर्सिंग के बारे में आप बताइए।
Good morning, viewers. I am going to say a few words about forensic nursing science in India, that how the journey started and where this journey reached. We started in 2002, invite to the Virginia Lynch, who is mother of forensic nursing science in the world. When she came, she spoke about forensic nursing science, and her talk ignited something in me, and I thought that forensic nursing science, which can be very useful to the criminal investigation system of our country, that should develop in India. And I started working on it. We did some research, we published the papers, and more people became aware about it. Then we took this journey to the different nursing colleges in Punjab, and ultimately to our university, Baba Free University of Health Sciences, where the Vice Chancellor invited all the forensic nursing people to talk about forensic nursing science, so that all the nursing colleges in the university, they become aware of it. After that, this journey to different nursing colleges around India. We mainly talk in various conferences about the forensic nursing science, so that all the stakeholders who will use the forensic nursing science for the criminal investigation system, they should become aware about it. And in 2009, we had sufficient people, and Indo-Pacific Academy of Forensic Nursing Science was established, and then we started working on a bigger way and going to India and to the different corners of India and to the different parts of the world, and we wanted to spread the cause of forensic nursing science where this was not present. Initially, there were lot of opposition that, as per the Indian law, what the forensic nurses will be able to do in India. But I had a conviction that once this forensic nursing science is developed, once the people know about the utility, the benefits of the forensic nursing science to the community, to our society, then the laws will not be a problem. Laws can be changed in India, and even with the existing laws, the forensic nurses can be useful to the society in ways. They can be useful in the emergencies where valuable evidence is lost because the people are bleeding, and then the doctors and the other people around, they don't value the forensic evidence at that time. So there was a need that these forensic nursing science should develop, and forensic nurses should be available in the emergency. Similarly, in the mortuaries, we can see their role, that they can be very useful in the mortuary settings. In addition to this, there are victims of the sex assault. So again, they they are investigated, but the level of investigation, the time spent by victims, so that is less. So there is a capacity in the victims, which, and usually this in some of the victim, about 33% of the patient, this symptom remains for throughout their life. So it is not just the handling of the victims at the crime scene. There are survivors who needs to be handled very carefully, and the forensic nurses can be very useful. Then there are cases of child abuse and child neglect. There are cases of elder abuse, elder neglect, So these cases are not properly investigated in India most of the times. So when the forensic nurses will be there, they will be able to detect both these types of abuses and take up the follow-up action. For example, if a child is maltreated by the parents, if the child is abused by the teachers, so if child is in the school setting, who will report this case? If one forensic nurse is present in the school, along with the other things, health care of the students, she can take care of that no child is abused, and in this way it will be very easy to stop the corporal punishment, whether it is at the home or in the schools. So now we have this Indo-Pacific Academy of Forensic Nursing Science. Um, we have about more than 250 members in this organization, and they are working to spread the cause of forensic nursing science in India. As far as the forensic odontology is concerned, so it was not present initially. In 1998, we started the journey of developing the forensic odontology. The motivation for this came when I attended a workshop in USA in 1998, and at that time I found that this this is a wonderful discipline, and this can help the investigation system in a big way. And then the research was in the Indian cinema, research was being carried out, and we did more research, and we published papers on the forensic odontology, and similarly established the Indo-Pacific Academy of Forensic Odontology, and at present we have more than 300 members in this organization, in which the forensic pathologist members are there, the dentist members are there, and some forensic scientists are also in this organization. So unitedly, we work to develop the forensic odontology in India. And now the forensic odontology is a part of the curriculum of the undergraduate BDS courses, and now the MSc forensic odontology has developed in many places. So forensic odontology is useful at many places, especially it is useful in the case of mass disasters where so many people die at the same time, and then there are no ways that this can be they can be identified. Then in all those cases, as a member of the team of the mass disaster victim identifications, so in all such cases the forensic odontologist can play a big role. In addition to this, there are injury cases coming routinely in the emergency where the help of forensic odontologist is required, and there are many criminal cases in which the age determination is required. So the forensic odontologist can be very useful in these circumstances, and there are so many other things where the forensic odontologist can be useful to the criminal investigation system. So I will say that I had a dream, I had a vision that 20 years back, that these two disciplines of forensic nursing science and forensic odontology should come to India, and I am very happy that with the grace of the God, so the things which were visualized 20 years back, now they are on the firm footing, and with the help of the many young people, new people becoming interested in this, our India is going to be greatly benefited by both these disciplines. Thank you very much.
थैंक यू सर, थैंक यू सो मच। तो आप लोगों ने देखा सर ने किस तरह अपनी फोरेंसिक नर्सिंग की और फोरेंसिक ओडोंटोलॉजी की यात्रा आरंभ की, और किस मोटिवेशन के साथ उन्होंने चीज़ों को आगे लेके गए। और मैं आप लोगों को यही मैसेज कम्युनिकेट करना चाहता हूँ कि हम सब मिलकर इंडियन फोरेंसिक साइंस को एक नए आयाम पर लेके जा सकते हैं। हम में से हर व्यक्ति एक नया काम करे और फोरेंसिक साइंस को एक नए आयाम पे वर्ल्ड लेवल तक लेके जाए। थैंक यू।